Okay, I'm Milton Bailey. I am 75 years old. I was born and raised at Menard, Texas. Played all kinds of sports and athletics. Later on, played college football as a defensive back before there were giants playing football. And I think that's probably the thing that has helped me recuperate from so many surgeries. I've had 9 different surgeries in my lifetime. A lot of it due to playing athletics. I said, we have been coming to Fredericksburg for at least 40 years for all of our medical stuff. I've had many surgeries here at the hospital. Actually, in 1 year, in 6 months' time, I had 7 surgeries, correcting things that just needed to be corrected. But on March the 10th of last year, I stepped off of a ladder, and I was higher up than I thought I was. I thought I was right at the ground, and I was 2 steps up. And when I stepped off, I hit crooked on this ankle, and it broke my ankle in 3 places and my leg in 1. Anyway, I came over here to an orthopedic doctor, and they took care of it, got it all straightened up, casted it, got out of the cast, out of the walking boot, and everything was going pretty well. Went through rehab with it. Then last September, late September, I stepped in a hole in the yard, just walking across the yard, and that thing broke through the ankle. And during this time, it had calcified. I have arthritis, and being the damage done to that ankle, it calcified in my ankle, and it broke right through it. And the only option I got from orthopedic doctors was to freeze these joints together. I would still have the pain, which I was in a lot of pain with that. And I didn't think that was a good option, or I didn't want to do it. And I found Dr. Karulaks here at Fredericksburg, and didn't even know he was here. And got an appointment with him, and they x-rayed it and checked it. And after much discussion, since I am a heart patient and I don't have but 1 chamber left in my heart that pumps, that's part of the reason the orthopedic doctors did not want to do any kind of surgery on that foot. But Dr. Karulaks checked with my heart doctor here, and they came up with a method to do it, and they went in and deadened my leg instead of putting me to sleep, and just kind of put me under with a little bit of anesthetic. And he went in and put a complete new ankle joint in that foot. When I came to after the surgery, I had no pain. That was one of our discussions before the surgery. I told him, I said, when we get through with this, I don't want to hurt. And he said, there will be no pain in that ankle. But sure enough, there has not been any pain. That was the 14th day of November last year when he did the surgery on it. I, of course, wore my boot, kept the weight off of that ankle, did the things I was told to do, and took very good care of it till I was able to do rehab on it. And the rehab doctor, by the time we got to do the rehab, I had been working on it some at home with the things I had done with it before when I broke it so bad. And luckily, the breaks that were in the ankle, when he took all of that trash out of my ankle, he took those breaks out. And when he put the joint in, that replaced the whole thing. And so I haven't had a bit of problem with it. I haven't had any pain with it. I walk well with it. I don't climb ladders anymore. I've been kind of told not to do that, but anyway, it has been really, really good, and I'm very appreciative of Dr. Karulaks' care for me and the way he did the work on my foot. And I would recommend him to anyone that has any kind of foot problem. He's a young man with a lot of experience and a lot of knowledge of what he does. Yes, we've been coming here to Fredericksburg for over 40 years for all of our medical attention that we need, and we'd much rather come here than have to go to San Antonio or Austin or any place like that, because it has a whole lot more of a personalized feel to it when you are treated. And of course, at one time when I had the 7 surgeries in 6 months, I got to know all the nurses upstairs that took care of me, and have become friends with a lot of them, and of course some of them I knew before. And when we went to bigger hospitals, that has not been the case. And it's more of a personalized service that you get here. And I would recommend this hospital to anyone with any kind of problems they're having. And if it is really, really extreme that they can't do anything with it, they will send you to Austin or San Antonio.
Hi, my name is Bryce Karulak. I grew up in Bernie. I've been a part of this community for a number of years. I've been working here since full-time in 2017. Did my undergraduate work at St. Mary's University, and then did medical school in Des Moines, Iowa. Residency was in Houston, where I performed a 3-year reconstructive rear foot and ankle residency along with foot surgery. So I always thought about going into the medical field since I was probably in about middle school. My mother was a nurse, and so that was somewhat introduced me. And then from that point on, I also enjoy a teaching aspect to it. My father's in education, and so while I spent a year teaching high school chemistry, I've found that medicine also has a component of education. Many times a patient comes in, doesn't understand what their issue is or how it affects their life or how it could be affecting them. And it gives me the chance to actually educate, teach the patient what's truly affecting them and allowing them, or not allowing them to complete the activities and the goals they have during a day. And so I found that this profession kind of married those two aspects together. I enjoy doing what I do because I give people their life back, truly. When you can't walk, or you have some type of joint problem or anything that keeps you from completing the activities that you enjoy during the day, it can really change your outlook on life and how you feel about how life is going for you specifically. And when I can solve a problem for a patient, they can move on with life and go back to their normal life. That's gratifying to watch people be successful in the things that they want to keep on achieving and keep on doing. As far as procedures, I perform pretty much anything that can be done on the foot and ankle. At least that's my training. So whether it's a neurological treatment such as releasing nerves, or replacing joints such as replacing the ankle joint, or something as simple as a bunion and hammer toes, I am trained to do all those things. And so sometimes it requires tendon transfers to balance the foot if a muscle group isn't working correctly, or it's severe arthritis has set in and the patient's having significant pain. A lot of times we'll end up fusing joints just so that they can have pain-free ambulation or pain-free walking. So I'm currently accepting new patients, and you can find me at hillcountrymemorial.org/find a doctor, or you can call my clinic at 830-990-1404. Thank you for your time, and I look forward to treating you in clinic and restoring your life.